disease like dengue, chikungunya, etc.?
Yes. That's a good question. That means in the case of all those diseases like dengue, chikungunya, etc., you are asking about the modern aspect of diseases. I think in cases of dengue, chikungunya, when an active viral infection is happening, it is not good to load your stomach with a lot of things which are hampering your digestion. Now, when managing COVID-19 cases, a lot of CFLTCs, that is primary COVID care facilities, were opened in our Kerala state, and government was giving good quality food there to people. For example, in the morning time, they will be having some boiled egg, the noon rice, the night time they will be having chapati, kurma, chicken, etc. We heard that the patient's disease was getting cured. The COVID-19, many cases were self-limiting, it was getting cured. But the post-COVID symptoms like lethargy, the recovery of digestion was, and the proper digestion was reduced. The patient feels GERD-like symptoms. So all those indicate that when a viral infection happens in the body, it is better to have light tummy for you. You are assisting the body to fight the disease with the more fluid-rich food. So our Acharya is also of the same opinion. He states in a different way that Agni is not present in Koshtam. So loading the Koshtam with more food will give rise to more Amam, which will block more Srodhas, leading to more Jwara. So that's why Langana is prescribed specifically. And supporting these patients with even with the rice gruel or the water of that gruel is sufficient. And also the patients, they themselves feel a truly affected people. Like but I say that if a person is tested positive for COVID-19, that doesn't mean that he is having all those symptoms. But if a patient is having all the true symptoms, he will definitely say that I don't want all those heavy food, I want simple food. So I think that is the importance of Langana.
Sir, another question. After Jara, if there is one different taste in mouth for more than 10 to 15 days with loss of appetite, can we consider this as Jara Upadrava? And how can we treat, sir? Please explain in short.
I feel that what we fix as the endpoint of Jara, it is different from our modern practice. In modern practice, if the temperature returns back to normal, it is considered as the endpoint of fever. The fever is finished. But Jwara is not finished at all. We have got Vigada Jwara Lakshana, Deho Lekhu, Vyabagada Klama Moha Tapa, Pago Mukhe, Karana Saushtavam Avyatatvam, Pragriti Yogi Mano Anna Lipsa, Svedakshava, Pragriti Yogi Mano Anna Lipsa, Panduscha Murtni, Vigada Jwara Lakshana. So, Karana Saushtava, that means all the Indriya should be optimum in their function. Then only we will say the patient has been fully recovered from Jwara. Otherwise, we will bracket him as still a patient with the Jwara. I think one different taste in mouth for more than 10 to 15 days with the loss of appetite. Sweda Kshava Pragriti Yogi Mano Anna Lipsa. That is another important feature. Anna Lipsa. The patient should be having a desire for food. Then only we will say the patient is recovered from Jwara. So this patient, I think this is not Jwara Upadrava. Instead, the patient is still continuing in the Jwara phase itself. Though the temperature has reduced,